So I'll just start the stream. All right, go. What is hard affecting me physically, mentally, emotionally, and work really hard on being good at
Healthy mind, healthy body, healthy life. Soul food on Smooth 98.1.
Soul Food right here on Smooth 98.1. Love music, love life, and we love your health. We want you to be well and in one piece. That's why we talk about your health and wellness every Saturday morning from 8 a.m. till 8:30 on the station that loves music and loves life. This morning, we are talking about nitrous oxide, which is otherwise known as laughing gas. Let's talk about the abuse, increasing abuse. You can call it an epidemic waiting to blow. And then what are the dangers? Why should we not allow these things happen? And to discuss that, to shed light on that, I do have my guest already joining me via Zoom, by the way. And you can go to YouTube to stream. It is youtube.com/smooth981 FM Lagos. Save the stream, share it with your family and friends, and remember to click on the notification bell so that you're aware anytime we go live. He's a medical doctor, he's a public health advocate, and this is the second time here, I believe. Glad to have the pleasure of Dr. Olusina Ajidahun, well, otherwise known as the bedded doctor or the bedded Shino. Good morning.
Good morning. Thank you so much.
I was worried
for having me.
It's a pleasure. Thank you for being here. All right, let's get down to it. Why are we talking about nitrous oxide, which is something that is meant for the hospital or meant for medical procedures? First of all, help somebody to understand what exactly laughing gas is or nitrous oxide.
Okay, so thank you very much for that question. So nitrous oxide, popularly called laughing gas, some people call it hippie crack. It has a lot of colloquial street names. It's the gas nitrous oxide. Now, nitrous oxide as a gas has both medical and industrial uses. Since I'm a doctor, I will aim more on the medical side. I'll just drop some tidbits about the industrial side. So for nitrous oxide, it's used in medical practice. It is used for anesthesia. So anesthesia is when you want to do surgery. It is one of those gases we use to put patients to sleep so they don't feel pain. Yeah, so that's basically its use in medical practice. Well, in industrial practice, it has some uses. If you've watched Fast and Furious, the nitrous oxide boosts from the cars is also used as propellant, and so some of these are aerosol like deodorant and all of that. So it's used in bakery world also, but for the medical area, which I'm sure is going to is going to form the basis of our conversation, is used for anesthesia for putting people to sleep for surgical procedures. Thank you.
All right, thank you. Now that this gas is no longer staying in the hospital, it's no longer staying in the industries, it's now finding its way to people's lungs. We need to have the conversation. First, let's talk about the accessibility. How accessible is this gas to the regular person who has no business with it, yet they are inhaling it? Why do we have such an issue of easy accessibility?
Okay, thank you very much. So now the issue of accessibility has stemmed from one, heavy promotion, especially by celebrities, and it's not being discussed about before now. So it was on a low key. So that was why another way it was able to flourish. But now that NDLA has clamped down on it, which we're going to talk about shortly. Now, the media. So for example, if you're an active user of things like Snapchat, Twitter, and Instagram, you see we have this balloon vendor. They call themselves balloon vendor. They just put it up there. Hit me up if you want your hippie cracks. Hit me up, send a DM, and I'll get it delivered to you. So it was all over the place. And the funny thing was that if you look at those canisters, they look so beautiful. Like, and you understand, and it also looks like if you see some videos, people are always like blowing balloons. So people did not even know. Everyone would just be like, why are adults playing with balloons? Well, so no one was talking about it because people just thought that The balloons are just, oh, you're just playing. So, and that also was part of the accessibility. So right now, you can go to a club, you find it there. You go to media vendors, you find it there, and it's just everywhere. If you want the thing, if you want a canister of nitrous oxide now, you can get it because it has formed the basis of a lot of parties, house parties, home parties, birthday parties. It's like a must-have. Like young people are experimenting with, so it is very, very much available.
Just to be clear, now this nitrous oxide, is it the normal gas that you use in filling balloons, or it is in quote an abnormal gas? I mean, is it the normal one
Yes,
that you use in inflating your balloons?
it's not normal. I mean, it's not normal. It's not normal. It's not normal for that. It's not normal. But the thing is, these guys, when people want to do drugs, doing drugs it comes with a lot of experimentation. Now, I did not mention earlier. Now, one of the things that nitrous oxide produces, which I'm sure we'll still talk about with side effect, it creates this false euphoria. Now, why it's called laughing gas is that when patients even inhale it in the theater, they are just happy, they are relaxed, they're like on top of the world, they are feeling like Dangote and Bill Gates. You just have this false sense of happiness. You understand? And that is the basis of why people are doing it, because it also creates that euphoria. So, and that's why most of them take it from balloons is that in the canisters, it is very, very cold. And the heat can actually destroy the cells. So it's very dangerous. Okay, though some people have taken from canisters and have had emergencies and had to go to hospital, but most people don't take it from cans because it's at a very low subnormal temperature. And if you expose the lips, the nose, or anything to that kind of temperature, it can actually cause frostbites and damage the skin cells. So most people will pump it into the balloons, as you see in those videos, then inhale it.
Wow, that is just dark. All right, then let's talk. Since you started, what are the telltale signs of someone who is high on such a gas? If at all you even want to help somebody to get down from those horrors of abuse, how do you tell, aside the fact that they're just happy, how do you tell that this person is most likely high? Now, this is why I'm asking. I saw a video, 3 youths thereabouts, they went to a place to get some things. They were in the park. They were trying to get some things into the trunk of their car. And one of them, at some point, was acting delirious. And the next minute, he was on the floor. I have no idea what happened between the place that they went to get the thing to there, but I'm not sure what happened. But something must have happened along the way because there were canisters with them. I don't know if they started inhaling. So brings me to the question, what are the signs, symptoms of somebody who is high on this gas?
Okay, very nice question. So the first thing is, let us even understand, how does this gas get into the body? So first thing is, it's a gas, which means you have to take it in. There are various means you can use to take it. Either you take it through the mouth or the nose, right? Now this gas goes into the lungs. The lungs are those like your I'm trying to use non-medical terms. The lungs are those organs that help us to breathe in and breathe out oxygen. And you understand. Now the gas goes from the lungs and it's able to go into the blood cells. So it goes into the blood. Now the blood is like the carrying system of the body. The blood carries the gas to everywhere, to the brain and all of that. So what will happen when someone takes it? Now, one of the things, it kind of affects the CNS. Now, the CNS is the nervous system. It affects the brain. And another thing it can do is also it can drop your blood pressure. You understand? So because there's a drop in blood pressure, the person can have this dizziness, fainting spells, and some people can actually have nausea. Nausea is they're feeling like vomiting. They can feel weak. Some people can collapse. If you go through my thread on Twitter, I actually attached a story of a guy that did nitrous oxide balloons, slept off on the wheel, and actually killed someone. Like the car crashed because he did nitrous. Then he tried driving, and he just slept off. And the car hits a mother of 3. Actually, I think it happened in I'm not sure, but in USA, I attached a story in my. If you go to my Twitter, that's one. Now the long-term effects. Now what usually happens is, one, nitrous oxide as a gas. Long-term exposure, the gas is dangerous to the brain and the spinal cord. So in the long term, it destroys the brain and it destroys the spinal cord. And there are cases of people that have actually had paralysis with nitrous oxide. I also attach some stories to that. That's one. Another thing it can do it now. Let's get a little bit more medical. Vitamin B12 is one of the essential nutrients we get from food. Vitamin B12 helps us in production of cells. We really need it for production of DNA. It's an essential part of our food. We absorb it. Now, nitrous oxide blocks vitamin C. So if nitrous oxide blocks vitamin C, we can extrapolate that. Nitrous oxide will also affect cells. So it can affect the livelihood of cells. Some cells can die and it can cause anemia. Other things that could happen with nitrous oxide is it's been known to cause heart attacks. It's known to cause sudden death. Some people can have loss of consciousness, some form of disorientation. Some people can have hallucination. It goes on and on and on and on. And another thing is, well, a lot of people don't take it from the canisters, like I said. But for some people that like to experiment, it can cause frostbite in them, which I explained earlier. And other things will be features of a majority of the features are features of damage of your nervous system. Your nervous system is the system of your brains, your nerves that control all of that. So they might not be working well, having this balance problem, their muscles are twitching, they are not able to feel. So a lot of things can happen with that. And at the extreme, is it can actually even cause asphyxiation. I also attached a story to someone that actually asphyxiated, I think, a young boy in Dublin, in Ireland. I actually attached a story to that. He died from nitrous oxide intake. So you can see that it goes on and on and on and on and on. Yes. So I'll just leave it at that for now.
That is just terrible, that all of those terrible consequences, side effect for fleeting moment of pleasure. It makes no logical sense. But hey,
Exactly.
now that we're here, I would like to take you back to something you mentioned when I was asking you the question of accessibility. You said celebrity promotion. What do you mean by that?
Okay, thank you very much. And if you've been active on social media, you know that there has been this fracas that I am a popular artist, Olamide, had like on or over this or nitrous oxide. Now, what happened was I think he posted a teaser from his upcoming album or it's a new project titled Unruly, and somehow that crossed my timeline on Twitter. And well, I'm always for health advocacy. I just and coincidentally, 3 weeks NDLA had invited me to give a talk on balloons. Like I partnered with NDLA about just 3 weeks to that. We had a Twitter space, about 2 hour space where we talked about balloons. So I then come around and say, oh, nitrous oxide, we just finished this talk with NDLA, and now we're having a celebrity openly glorifying balloons and all of that. And well, trust the media to make that catch fire. It was all over blogs, newspapers. I started getting calls from everything. And obviously his fans didn't take it very, very lightly. It's not, you understand, they thought rather than see what I was doing, they thought I was trying to attack their faith, which is another problem I think we talk about. And this is it's not only about him. A lot of musicians use this thing in their video. And we all know that celebrities are very much impressionable. They are able to influence and wield influence on a lot of young people. And so as they are showcasing this thing, if you watch a lot of music videos, you probably would think they are balloons. Trust me, they're not just playing with balloons. Nobody in their 20s or 30s will just take balloon and just be blowing it. They are doing drugs. So now that we know that it's part of it, they're showcasing it, it becomes part of people's subconscious. Young people want to experiment, and young people want to try this thing because they've idolized these celebrities, and that is where we have the problem.
That is a call for concern, or rather a point of concern. Anyways, if you have any question, if you have any contribution to this, please, by all means, be a part of it. There is WhatsApp, which is 0809-444-0981. Again, 0809-444-0981. While you can call 01-448-9981. Again, 01-448-9981. Just like you rightly said, according to the NDLEA chairman, I believe earlier in the week, he mentioned how the issue of nitrous oxide is a fast emerging drug, and also the demand for it in Nigeria is increasing, especially by young party goers and fun seekers who are feeling intoxicated as a result of inhaling the gas, and they want more feeling of euphoria. And considering the fact that today, 15th of July, happens to be World Youth Skills Day, it is something to be talked about, and how these things can damage you short-term, long-term, and your future. It can wipe out that future that you are looking forward to. So please, children, youth, adults, do not do drugs. That is clear, simple. Now, let's talk about clamping down and reducing these things. First, on an individual level, is there anything any human, a single individual can do to reduce the spread of this thing? And then we move forward to health agency and maybe government institutions.
Okay, thank you very much for that. So I think the first thing we can do as individuals is one is awareness. Now, we should not leave the work to health agencies. We need to talk about this. We need to have more conversations around this. We need to, talk about it in social media. We need to do a lot of health promotion. Let's go to secondary schools. Let's go to primary schools, because right now, an average primary school goer actually has access to TikTok. Even if they have access to TikTok, and you'll be shocked that an average schoolgoer has a cell phone and all these things. It's not till they get to university they get to know it. They actually know it from primary and secondary schools. Let's collaborate with teachers. Let's talk about it with parents, because when parents are able to sensitize their children and let them know that if you take this thing, you can die. There's no point sugarcoating it. Don't let us make it look like well, if you take it, maybe you'll feel high, but well, no. Let us spread the dangers of doing something as harmful as nitrous oxide. Another thing is we also need to partner with religious houses, churches, mosques, and maybe traditional homes. So because Nigerians are highly spiritual people, and a lot of Nigerians actually model their lives after men of God. So I believe if we can also partner with religious institutions, and during Sundays they're able to give a word and say these things, don't do drugs, don't do this, a lot of people, we're going to reach a lot of people. And another thing I think on a personal level we can do is also mobilization of outreaches. Let's have more drug awareness campaigns. Let's go to the rural areas. Let's go to the urban areas. Let's have placards. Let it be in the supermarket. Let it be in the libraries. Let it just be staring at us, because we are heading towards heading towards a time where we're going to have drug pandemic, and it is going to tell on everyone. It's because somehow someone that is either related or linked to you it's going to be affected if we don't nip it in the bud. So I think at personal level, these are some strategies we can employ. Let's use our WhatsApp status. Let's talk about it. Let's use just every platform. The media, let's partner. Let's talk about it. Health influencers, let's partner. Let's talk about it. So I think at personal level, these and we'll have more sessions like this also. I think those are things that should work.
What about reducing the accessibility to that gas? I'm particular about that.
Okay. Well, that won't be at personal level. I feel that would be at agency and institutional level, because they are the ones that control the importations of things. So I think firstly is that one, we need to limit the accessibility. Now, if you look at the yesterday, or I think yesterday or 2 days ago, NDLA actually clamped in on someone that had over close to 64 tons of laughing gas. Now, let me just break that in context. 64 tons of laughing gas can actually supply close to 10 hospitals and for a year. Now, that is one person is having access to that amount of laughing gas. How? Why? What do you want to use it for? Well, I'm very glad that it was intercepted. So that's the first thing at the borders. The second one is, well, now NDLA has made it illegal. Now we know that it's illegal if you're doing balloons, if you're doing nitrous oxide outside medical uses, would need to, you can actually go to jail. Another thing is that I believe we need to also raise awareness. I'm not so sure where people get this apart from social media. You understand? I don't know if they are like pharmaceutical stores that really sell that. I'm sure that if you want to buy that from pharmaceutical stores, they're going to ask for a license or something. Well, if there are houses, recreational houses that sell things like that, I think we also need to spread the word to them that they should only sell to people that are using it for medical and industrial use, and probably have a license, because this is Nigeria. People can falsify things because they want to divert supply. Then also, I feel that we should also have NDLA needs to partner with organizations like the NBC, so that we can also censor some of these videos, because I believe that if we don't give some of this video videos enough publicity, it's part of it because people don't get to see it because they know. Also, as said by the spokesman yesterday, I also had another program with the NDLEA, of which the spokesperson for NDLEA was there, and also talked about that, how they much have been collaborating with schools, collaborating with a lot of organizations and drug-free organizations. I think we need to do more of that. Let the NDLE, which they are already doing, collaborate with more people and stakeholders in this. Then I think another good thing is we also need to put influential people, which I suggested, though they have, and the NDLE also mentioned they have already. We need to also put influential people at the forefront of this drug awareness campaign, so that, I mean, if young people have idolized some people, I think it would be good that we also have those that have a clean slate and are anti-drugs to come and say, hi, young people, no drugs, we don't do this and all of that. And yeah, and I think the last part is we should have more rehabilitation, because right now that people are getting to know the side effects of these drugs, we are going to we'll get to a point where people will openly want to seek for help. So let us have more rehab sessions so that people can check into rehab, seek for help, and get adequate help so that they can come out clean from that and tell their stories, which I also talked about with NDLE yesterday, that I believe if more people come out and tell their stories, how they struggled with drug use and how they broke free from their addiction and how they're doing very well, it will motivate more people to stop doing drugs, seek for help, and also tell their stories, which is going to be a very great cycle. Thank you.
Thank you so much, Dr. Shino, for what you are doing, the work you're putting, and how you are trying to help us with this. Thank you. And of course, we must commend the effort of the National Drug Law Enforcement Agency, which is NDLEA, for their effort as well. It is commendable, but of course, there is always space to do more because this problem needs to be properly nipped in the bud. Now, you have answered a huge chunk of the question, but I'll take a little part of it from Emeka from Bagada, who says that, is nitrous oxide gas imported or is it synthesized locally? I believe you've talked about it because it was asking if it was imported, how can it be regulated? But I'm curious about the local synthesis. Do you think it can be synthesized locally?
I don't. Well, I don't think it can. It is. I don't think it is synthesized locally. But never say never. I have not explored this. It's possible we might have some illegal factories. Well, I think if we have factories in Nigeria, should be able to synthesize nitrous oxide. They should be. But I don't have information to that. But majority of it is actually imported. But I believe that we should have industrial factories that can actually make out. If our factories can produce oxygen, I see no reason why they cannot produce nitrous oxide. So we should have a lot of that. But most of those ones that these people are using, those hippie cracks, those ones are actually imported. But I'm sure a great deal of the medical nitrous oxide use comes from Nigeria, because we don't have to import that. It's so easy to produce nitrous oxide. But the ones that come in those hippie cracks and those fancy ones and those fancy canisters, I don't think those ones are produced in Nigeria, because if you actually pick a lot of them, you will actually see that they're not actually made in Nigeria.
Well, that means if they can be, there is a possibility of them being produced in Nigeria. There also needs to be that regulation as well, to be sure that everything is complying with the standards and the distribution. There was a time it was done for cough syrup, the one with they remind me of that specific ingredient that made people
codeine?
Sleep. Yes,
codeine.
Thank you. Yes,
codeine.
So there was a time they clamped down on that, even though it's not totally gone, but it has greatly reduced. So if they can do that for cough syrup, they can also do it for.
Yes, and another thing I was just going to say, sorry to interrupt you, is that apart from the canisters, I mentioned earlier that nitrous oxide also has a lot of use. So even in the deodorant, some of these deodorants, it's used as a propellant gas. So some people, what they do now is they cut open the those like body sprays and stuff and actually start sniffing. You understand?
What?
So it's actually bigger than the canisters. Nitrous oxide, if you take a lot of products, we even use household products, household products that are gaseous, you would see that some of them actually use nitrous oxide. So some young people, because I was discussing my consultant yesterday, where he had cases of young people that were actually cutting the those whether deodorants, body spray, and actually sniffing it. because they wanted to get high. So people are also for those that cannot get the expensive ones, so that people are actually experimenting by cutting open canisters of like sprays and all of that and trying to inhale it also. So I think it's also close by, are very much available also.
That is mind-blowing in a negative way. The lengths to which people will go just to satisfy their immediate pleasure. And of course, at this point, parents, definitely guardians and people need to step in to be able to, or to be sure of what their kids and children are doing. Now, I believe this will be the last question, which is in relation to something I wanted to ask. Wilson says, how can this phenomenon be managed so as to mitigate or eliminate, if possible, the deadly effect of the substance? If I will rephrase that, when someone, because you mentioned nausea and fainting spells as part of the symptoms, so how do you help quickly, say, provide first aid help to someone who is high on the substance?
Okay, thank you very much for that question. Well, I would say that there's little you can really do. So if you suspect someone just took laughing gas and is maybe wobbly, not working well, I'll just say quickly support him. Make sure that you remove anything that is dangerous around him. You understand? Get him to either lie flat on the floor or sit down, and just try to get him to a hospital, because there's not, you can't really do much. You can't say you want to give an antidote to get that gas out of his system. What you just need to do is ensure the person is safe, remove anything that is dangerous around the person, ensure that the person is not in a space that is closed, that it can hit his head or hit anything else, and just try to support the person and support him and go straight up to a hospital. You understand? It's not, you cannot really do much, but what you can do is just ensure a safe transport of the person from the site or from that. For example, now imagine someone did nitrous oxide, no one was there. He felt dizzy, he falls down, hit his head and bleeds in the brain and dies. I mean, that's one thing that could happen, which happened in one of the stories I put. So the best thing is, you suspect someone just did that, just go close to the person immediately, support him, make sure it's not lying or just standing on his own and all that wobbly. Support him and get transportation and get him safely to a hospital.
Thank you so much, Dr. Shino. It's been an enlightening session with you this morning, and we really thoroughly appreciate it. Now, to keep up with the work you're doing,
Thank you
not
so
just
much.
about this and every other thing, how can people find you on social media?
Okay, so for now I use a lot of Twitter. So a lot of I do a lot of content, hundreds of contents. You would always see I create a lot of health content. So you can find me on Twitter at the bearded Shino or the bearded Dr. Shino. Once you just type that, I have a verified handle on Twitter. So once you can follow me, and I usually also host health sessions. Well, I usually also post my Telegram channel, because I have a Telegram channel with a lot of subscribers where I post free health content. So people can follow me there. Well, I've not really been using Instagram because I don't really do a lot of videos and pictures, but I do more of like words, conversations, talking, hosting health sessions. So sorry, Twitter works more for me. So yes, you can follow me on Twitter, the bearded Shino, the bearded Dr. Shino. My handle is verified there. You see it, and also my Telegram channel, which I have my link there. You can also join that, and I'm also usually hosting sessions so that people can interact with the public. And since I work with a lot of brands and multinationals, we usually come up with spaces where we talk about things that are trendy or things that affect health issues. Oh, thank you.
Thank you very much. It's been
Oh, and
groomed.
also my
Yep.
email is also there too. So my
All
email
right.
is also there on my in case people want collaborations and all of that. So my email too is on my bio. People can send me emails also for, yes. Just wanted to put that.
All right. Thank you so much. We appreciate your time, your presence, and the education you have shared with us this morning. And for someone who's just tuning in and you feel you have missed out a whole lot on the conversation, don't worry. There is a replay for you on YouTube. It is youtube.com/smooth91FM Lagos. And for those who are part of our WhatsApp family, we will put the link for you on our WhatsApp status so that you can just click on the link and it will take you right to the page and the video. You watch it. Share this with people because it is very important for the education to go around so that they are aware of the consequences the long-term consequences, the short-term consequences of something that comes from fleeting moment of pleasure. And I'll tell you, or rather, I'll leave you with a quote that is from Donald Lane Frost, who says, drugs take you to hell, but they are disguised as heaven. So just be careful, be mindful of your actions, and save yourself, save those around you, the pain, the cost, the heartache, or every other thing that can come as a result of drug addiction. And of course, for those who are models and influencers in one way or the other, don't just live for yourself. Now, you might not necessarily ask for the life of people looking up to you, but now that you're there is almost nothing you can do about it. So how about you use the platform and the fame you have for something good? For the sake of someone that is looking up to you, please be mindful of what you post out there and the message you spread. Thank you, Lagos, Nigeria, and world. On the other side, we will be joined by a child author and singer, and why children should love reading is the topic of the discussion, as well as a book reading. So join us on Curious Mind from 8:40 for the children between 6 to 15 years of age. This is Smooth 98.1. Thank you, Dr. Shina. Thank you
You're
so
welcome.
much. So have yourself a lovely weekend and all the best with that thing that made you turn off your video.
Healthy body, healthy life.
Yeah, the thing is, I'm actually trying to get ready for work, and that's why I could not do a video because yes, I'm going to be working today. So, and I'm trying to get ready for work. So
All
my
right.
apologies.
No, it's
I
fine.
know it just
It's
came.
fine. It's fine. Thank
Okay,
you so
okay,
much.
it's
All
all
right.
right.
Have
Thank you
a
so
lovely
much.
day.
Yeah, is it possible I also get the link to this
Yes, I
the
will.
link?
I will. I'll share it with you.
Okay, all right. Thank you so much.
All right.
Okay, so I
Bye.
just share with some of my followers. Thank you. Bye bye. Yeah.